Okay, so good evening. We'll start with this session. Will have two parts. One is the distal radius fracture and causes of radial sided wrist pain. So to start with, we'll have talk on radial sided wrist pain. We have to divide when once you see a patient who says I've got pain in the wrist. The first thing we should see whether he is saying the pain is on the radial side, the pain is on the ulnar side, or pain is on the center of the wrist. There are specific reasons why the pain occurs, and this we are going to talk in the next few minutes. If the patient has say distal radioulnar instability, the pain will be on the ulnar side. If he has got ulnar impaction syndrome, the pain will be on the ulnar side. If he has TFCC tear, the pain will be on the ulnar side. If the fracture of the ulnar installer, the pain will be on the ulnar side. But these are extremely specific, and therefore we should deal with what really causes the pain on the radial side. The pain on the center may be a Kienbock's disease, and therefore we'll deal with only the radial sided pain here. There are a lot of things happening on the radial side here, and they are all, the important thing is they are all managed very differently. It's not a shot of steroid that you give whatever patient presents with. And since they are all managed differently, we need to identify and specify what really is going on wrong there. And you have to have a very specific tailor-made approach to this problem here. The first thing is that both the patient and the examiner sit across each other so that the elbow of the patient, the examiner are resting. And this is important so that you can relax the muscles of the forearm and the hand of both the examiner and the patient here. Now, what can go wrong on the radial side here? It can be involvement of the nerve. It can be involvement of the tendon, like a decurvent disease here. It can be problem with the radius. It can be problem with the scaphoid. Now, we are not going to talk of acute scaphoid. We are trying a chronic presentation here. So, we'll not talk of fracture presenting acutely here. And these are all the situations which happen over a period of months and years together. It can be a problem involving the joint, the scaphoid, trapezium, trapezoid, or the carpo-metacarpal joint. So these are some, not all. This is not an exhaustive list here. There can be more. There can be intersection syndrome here. That can be limbar comsock. There's so many of them, but we'll not deal with them. We'll be just talking few of them which present with pain on the radial side of the wrist here. The bottom line in all is other than other examinations here are the pinpoint tenderness. You have to exactly say where the tenderness is. If you miss the location of the tenderness, you will mess up the specific diagnosis. So tenderness is the most important thing in clinching the diagnosis. Let's discuss a few of these.